Good morning. Today is November 1st. We're going to start the lower limb. We're going to continue the lower limb. Last week, 2 weeks ago, we did distal leg, and I uploaded the nerve of distal legs, including sural and plantar nerves. And I made a mistake that there's one slide which is third layer of the foot muscles. I was wrong. I'm sorry, guys. That's not abductor hallucis, adductor hallucis. Transverse head and how do you say? Longitudinal head. Transverse longitudinal, same. Oblique head. So please forgive me, adductor hallucis. Okay, we're gonna start, and today's mother is whom? Debbie Cassidy. She's our junior fellow, and then we're gonna. Where do you want to go over?
I think we should do the anterior approach, the lateral approach, and the medial posterior.
Okay, so we're gonna repeat the last week. So if Debbie has great muscles, I'm gonna make slides out of her muscles. Okay, guys, let's start. Hannah, can you tell me if you see this video, or anybody can give feedback that you guys can see it, or I check my own video. Okay. When Jeremy comes, with the goal of this one is showing beautiful David's leg, right? So this is, I have to bring the. Still David's leg, you cannot see it. Oh, good. You wanna hold it? I think I'm gonna. I should work at the TV station.
Perfect setup for filming.
I think I have to bring the bed up. Uh-oh. Can you guys see better? Okay. So I'm going to go over the surface anatomy first. So tibia, the inferior knee, and then this is the tibia, right? Along the tibia, are you ticklish?
Yep.
Yeah. And then from the tibia tubercle, usually we set the motor point. If you do EMG, and then motor point of anterior tibialis is 3 finger breadths down, about 1 finger breadth away. That is the motor point for the anterior tibialis. And then posterior tib, according to anatomy, we can do divide by 3, proximal 1/3, mid 1/3, distal 1/3. So mid 1/3, there are motor point for there's motor point for posterior tibialis. So you can approach from medial side, or you can approach from the posterior side. If you are pediatrician like us, and then you can actually approach from the back if you have a long needle. So that is it. And then extensor hallucis longus, the best part of the, I don't think I remember any cadaver study has been done for the EHL, but EHL is distal 1/3, and then 1 finger breadth away from the tibia, and then towards to the EHL tendon, and then you will get the best motor point. And then peroneal muscles from the fibular head and lateral malleolus. And then when you draw the line, if you have very thin leg like Debbie, and then you can have some how do you say, depression, dimple along this line, and that's the peroneal muscle, the initially peroneus longus. And then from about just before distal 1/3 from the fibular head, already peroneus brevis is popping out. By the time you go to the lateral malleolus, peroneus brevis is still muscular, but peroneus longus is only tendon, you can see. So if you look at the my lecture from last night, when you look for the sural nerve at the lateral malleolus, you're going to look for the peroneus brevis and Achilles tendon. In between these two structures, you can find a small saphenous vein and sural nerve. Okay, so and then we're gonna start to show today, since this is the review, the left side of the screen is gonna be the tibia side. So let's start from the top. Can you see well? Very good. And we made it deep. So left side of the screen. So the always when you do cursor, right? Cursor. If you understand what is that in the middle, how are we gonna get rid of that? Dr. Kim. Oh, good. So this is the cursor, and then you put cursor there. Okay. So. Debbie just came back from inpatient, so forgive her. This is the anterior tibialis. You can see facial lines very proximal of the distal leg. So therefore, if you freeze here, there's no extensor hallucis longus yet. So you can see, oopsie, she has, we're gonna freeze and then cursor, then we move, then it will move. You can see there's a fascia line here, right? Fascia line. So after this, before this fascia line, this is all anterior tibialis. From this fascia line, you see another fascia line here, right? See? This one, this is the extensor digitorum longus. There is anterior tibial artery, very small here. Next to or above the anterior tibialis artery, there's deep peroneal nerve. It's going to come from here. And this big one is peroneus longus, this much. So this is the tibia, this is the fibula. So that's why you guys see bone shadow. Bone shadow, right? I'm going to unfreeze. So let's start from here. So please go back to my previous lecture. There is a lecture series in the YouTube. You guys can find the distal leg part. So we see, I'm gonna scan down. Now anterior tibialis is getting bigger. Let's ask, we can show Doppler, right? So CF on the top, colorful, yeah? And then use the trackball, yeah? Put it in the, see, there's a anterior tibial artery, and next to the whitish part is going to be the deep peroneal nerve. Deep peroneal nerve coming from the common peroneal nerve, right?
Yep.
And then common peroneal nerve coming through the between the tibia and the fibula, that hole. So we identified that one. Then we can you get rid of the color flow? Then we're gonna scan down continuously. I think I see some deep peroneal nerve over there, some white stuff. If you look at it, yep, you see the white one. I said, let's see if Debbie and I agree each other. Where do you think you have a deep peroneal nerve?
It should be right near the
They don't
artery.
say it, your finger.
So
Good morning, Jeremy.
Morning.
Hit the cursor.
I'm trying.
Cursor. I think I'm learning new things from Debbie. So, cursor, see? You have to move like
this?
Yeah.
Okay.
I
That's
think
it.
that's it. You agree with me?
Well, it should be lateral to the anterior
Right,
tibialis
so this
side,
is the anterior tibial artery, this is the deep peroneal nerve. And then we're gonna go peroneal side, right? Peroneal side here. You see peroneus longus, ooh, so big. So let's start from, because sometimes I cannot differentiate between peroneus longus and brevis. So here, longus, right, longus. Look at this, peroneus longus is so big actually. All of them, the oval shape.
all of that.
Whole oval shape is the peroneus longus. So the peroneus longus is much bigger than what you think. And then you come down continuously, peroneus longus, 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 longus. Actually, you can see that the superficial peroneal nerve over there. I don't know if you see it on the left side of. I'm gonna put. Yeah, that one. So you look at it. See, peroneal nerve is moving. Superficial peroneal, and then Now it's almost parens longus, it's brevis here.
Right down
Do
here.
you see? This is the longus, right?
All of that is.
All of them are longus.
Closer to the bone, right? Should be brevis.
So this is the all longus from here. All of this.
Mhm.
Then here you see popping out this one. Here there's no this. Look, pay attention to this part. This is proximal. Look at my probe. This is a kind of in the 1/4 from the fibula head, right? So if we look at it, there's only one. There's no facial line.
Right.
Now I see popping out on the. Do you see it? The pop?
Yeah.
That's the parens brevis. Now for the first time I was able to show to you guys. Yeah, that's the one. I'm gonna proximally move my probe. It's gone, right?
Right.
Now so slowly from about 1/5 or 1/6, right, from the fibula head. 1/6 from the fibula head. From the fibula head to the 1/6 distal is the only parens longus. After then, let's take a look. Parens brevis is popping out. Look at this, a little dark part popping out. See now, the longus is getting here. If you see, longus is almost gone. Almost, right? It's only brevis. So when I ask you guys to do, if your patient has plantar valgus from the spasticity, then I ask you to do injection to parens longus and brevis. So longus, the motor point is 1/3 finger from the fibula head, but the parens brevis motor point, I always telling you guys, from the lateral malleolus about 1/3 proximally from the lateral 1/3. So you can see there's absolutely beautiful parens brevis only almost. So by that time you scan down to lateral malleolus, you only see fibula, the parens brevis. So I'm going to go down continuously. Can we have some gel? This is good. We can a little in depth. We can repeat. Okay. So I'm going to continue from here. The only parens brevis you guys see it.
Mhm.
Down, 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 down. So why don't you make the depth a little less depth? Yeah. Up, 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 up. And then I am going close to the lateral malleolus. This is, I have to go like this. So you can relax. Because for her to show, maybe you want to twist your body a little bit. Oh, thank you. So here, lateral malleolus. Here, see, look. Over there, on the left side of the screen, the round one. Yeah. Hold that one, the parens brevis. By the time you come here, parens longus is tendon only. So you got, I think, on the tendon, little teeny tiny, where your arrow is.
In the top left corner?
Yeah,
or
yeah. Top of the corner, yeah. No, that's the bone. But this one is the parens,
Okay.
must be parens longus. This is all parens brevis. And then you already, I see it, the small saphenous vein here. And this is the sural nerve. This is Achilles tendon.
Okay.
So we can continue last night lecture which I uploaded. So why don't we start from here, more gel? You can give me the, I want to own the gel, okay? Look at this. And then I'm going, after this I'm gonna, I think we have to change the gain, right? And the depth. So
You want it more
Debbie
cerebral?
has to be more in charge for this ultrasound, right? So let's say this is the lateral malleolus here, right? And the Achilles tendon. So left side of the screen is the lateral side of the leg, and then right side of the screen is the Achilles tendon, which is the middle of the posterior calf, right? So look at this. So now you know parens longus. Oh, it's much clearer
Both
here. Yeah, you see both, right?
Can you freeze it?
Uh-huh. And then, okay, now you show me where is the parens longus. You have to actually.
Oh, I did.
You
I didn't read.
Hit that arrow.
have to, yeah, good.
Okay.
So where's the parens longus?
It's the one in the top left, right?
Yeah, the round, small round.
To the
That's
right,
the
that
longest.
is a tendon in the sheath.
And then peroneus brevis is still
Right here.
muscular, more bigger than that, right? And then round is the small saphenous vein. It's very hard to see the sural nerve here, but honeycomb shape next to. Where's Achilles tendon?
That's the Achilles tendon.
Achilles
that's
is a
right.
whole big one, yeah, whole round.
So, alright, Achilles.
No.
This is-
Achilles is that one.
And what's
Arrow.
this? What is?
No. That's the little hemorrhage
That's-
area. Hemorrhage area, you remember? Okay, unfreeze.
That-
Achilles
that's the
tendon is
brevis.
this one.
That was the longest.
See? This is just space.
Oh yeah, there's the Achilles.
That's the
To the
Achilles
right,
tendon.
yeah.
Oh, make
So
it.
it's just
You
space.
can't gain. You. So now, Debbie, you have to be familiar with the ultrasound machine, right?
Mhm.
So I put more gel. And then make it less that deeper. Okay, this is good, right? So I'm gonna show this part from here, Achilles tendon. This is a lateral malleus on the left side, right?
Yeah, this is.
And then Achilles tendon is this one. Where's the Achilles tendon?
This is.
Achilles tendon is in the right
Right.
side, the hazy one. Yeah, all of them.
Kind of looks, yeah.
But you cannot have Achilles tendon here. That's deep area.
Right.
Achilles tendon is this one.
So
Look,
it should be the
look
furthest.
look at your leg first.
Yeah. should
The
be
furthest
all of
muscle on the
this.
screen.
Yeah.
So what is it between the peroneus brevis and the Achilles? Just like fibrous tissue?
Yeah. See,
This.
there's a subcutaneous tissue.
Okay. It just happened because it looks very
See,
muscular.
look,
It looks
that's
muscular.
not muscle. There's no muscle.
Yeah.
Look,
But
and
it looks
here.
muscular. That's fine.
If
Yeah.
you go to the a little higher level, that where the PIP block the sural nerve,
Mhm.
it's what they said is from 2 centimeters from the lateral malleolus, they recommend us to block the sural nerve from 1 centimeter, 2 centimeter. I'm gonna put the probe here, so you can see sural nerve better over there, right?
Yeah.
Okay.
See. Now the more peroneus
Brevis is
brevis,
big.
longus
Okay.
is still small. See, well, maybe this is better to follow longus. See, now I'm very clear what is longus brevis actually.
Longest on top, brevis
Oh.
is the looks like
Closest
the
to-
goggles.
Yeah, so this is good way to scan up, right? So we can clear what is longus brevis. Now longus is getting bigger here. So now facial line, do you see it? Yeah,
Here
that's the
and here.
facial line.
Yeah.
Now it's more longus. Interesting, right? Okay, so we're gonna scan up and down one more time to clear peroneal muscles. Okay, here, can you try to change the gain a little bit to better, to show better? Okay, so now this is all peroneal muscle, right? Peroneus longus, all of them.
Yep.
And can you make deeper? Make it deeper, spread. Deeper, the other way. Okay, then you can see the environment, right? So here I'm moving to front. So there is tibia, anterior tibialis, and then facial line. You slightly see that facial line over there, right?
Right here.
Yep. So that's
Medial.
the extensor distal longus. And then I'm moving back posteriorly. Now you start to see peroneal muscles. This is only peroneus longus. And then when we go down above, actually from here, this is the peroneus brevis already popped out here, lower. And then we're going to continuously go down. Peroneus longus is getting smaller, still is there, right? Smaller, smaller. So I'm going to go down. This is brevis, mostly longus is very teeny tiny. Can you show longus?
At the
Yeah,
top
that's
here.
the longus, right? Now we know very clearly.
Yep.
Now brevis,
All of that.
and then I'm moving my probe I'm hitting the lateral malleolus, and then there's Achilles tendon, and small saphenous vein. So you can use the color flow and then make the depth shallow, right? So you can show better. You have to change the you're interesting the field box to the
here.
You have to move the box. Trackball is the one. Color flow, you have to hit the color flow. And then move your box. Good. Now you know what to do. Well, we have a less gel, maybe that's why. See, it's better now. Sometimes I want to make the box go here. It's coming. That area. And then can you change that one? Just to remove the color flow. I'm still having trouble with this runner. There is a runner. It's going into now subcutaneous tissue. Yep, that one. Now is the dark one where the arrow is. Do you see it?
This?
Yeah. That's the vein, but
Okay.
next to it. They are moving together until you go to. Her sura nerve is a little tough to see. It's the to me small saphenous vein. Oh, that's the sura nerve. So there you go, sura. Now you see two.
Right here.
Yeah. Very interesting. See that? Do you see two things, right?
Two.
That's the saphen. This is the small saphenous vein. This is the sura nerve. Sura nerve is close to the Achilles tendon. Small saphenous vein is close to the peroneus brevis. See now it's moving. It's going into the subcutaneous tissue, right? You see? See over there. That's the that's the sura nerve. Sura nerve. And now I'm in the about distal 1/3 from the knee. Still we have only soleus. Now you see the lateral gastroc and left side is the lateral gastroc.
Right up here.
Right side is the medial gastroc head. In my lecture, when the gastroc 2 heads meets, in the think it more depth. So now we can. So this is the lateral gastroc. This is the medial gastroc. When the gastroc 2 heads meets, in the middle, mostly in the middle, we have a sura nerve and small saphenous vein going through. So for now, I'm going to go back to, there's sura nerve. I know. This is the one, yeah. So it really is close to the 2 heads, where the 2 heads meets. That's the sura nerve. See, coming down. It is, some people we can, I think last 2 weeks ago, or 4 weeks ago when we do that, the sura nerve was relatively well showed. It was easy to see. And then, so we are doing sura nerve again, but at least we studied, so we're going to continue to study anyway. So here, so you guys clear with the lateral side of the leg?
I think so.
Okay, then we will talk about the nerve what later. But you saw the superficial peroneal nerve too. Superficial peroneal nerve goes where?
Perineal or fibularis brevis and longus.
Right, and then also it's sensory branches, right?
Yes.
So okay, so now we did the anterior, right? Anterior, but we didn't mention about the extensor hallucis longus, right?
Right. You don't
So-
see until more the this area.
Yeah, so now still two fascia line between the anterior tibialis and extensor distal longus, and then peroneal muscles is very clear. 3 muscles we see
1,
here.
2,
3. Oh, perfect, A plus. And then you see anterior tibial artery pumping. So I think we talked about this one before. This anterior tibial artery is moving as we scan down. Is going into the tibial side from the fibular side. Because this all the distal leg of the artery supply from which artery? It doesn't matter, anterior and posterior, or from
Popliteal.
popliteal artery coming from where?
Popliteal artery comes from above. We have,
You mean like femoral artery?
yeah, but it's
Right. Or everything
external.
coming from the femoral artery. Femoral artery supplies distal leg, anterior and posterior.
And it's external femoral artery, not internal.
So interesting, right? Without the femoral artery.
We don't have
Okay.
any
We have no vessels to
But
the distal leg.
couldn't you say that about anything?
Huh?
Couldn't you say that about anything? Like without the axillary artery, you couldn't
Oh yeah,
have
but
vasculature of the arm.
But I was thinking there's a separate artery from the posterior part. Like let's say I can make the
Oh.
artery named sciatic artery.
Got it, okay.
There's no such thing.
So at the level of the
Yeah.
popliteal, you get the anterior and
Right.
posterior division.
Okay.
So because it
Got
comes to the I think adductor hiatus and then
Okay.
going into become popliteal artery
Yeah.
and popliteal
Yeah.
artery divide going through the anterior tibial artery, posterior tibial artery,
Tibial
and then they
fibular
split
trunk.
the tibia and then fibular artery.
No matter which compartment of the leg you're in.
It's
they're
Yeah,
all
always
supplied. Okay.
So now, because we always, when I see other people's ultrasound teaching part, they don't really mention which muscle, which artery. Just like, oh, here nerve, follow, but we have to know everything. So that's why here you don't have artery yet. Look, it's not coming yet.
No.
Right?
Too
And
high.
that's
Very-
has to
this
go.
is
That's has to
very
go
high.
more anterior.
Yeah.
Yeah.
Right?
Yep.
Sorry, more proximally.
Yeah, proximally. So
The-
proximally here, but now
Yeah, no, you see it right here.
Wait.
Coming. Right?
no, there's no artery.
It's not there.
No, it's not there yet, but it's coming in. Go back
No,
now. more
coming
distally.
from in between the tibia and fibula here. So
Go more
if I go
distally.
down distally, it's
Yeah.
coming now here.
So
now we
is
see
that,
it, right? They don't
Yeah.
go like that. So
No,
as I
no,
come
what is-
down,
then what
it
is
moves.
this over
Look,
here?
look. Now artery is moving.
Yeah. So go back more
Now
proximally.
distally, proximally look
Yeah. Yeah.
here,
Yeah.
here.
Yeah. And it's
Here.
going to the
It's
left
gone.
side of the screen.
Nope, that's
What is
facial
it?
line. That's facial line.
Why is it
That's facial
Why
line.
is it hypoechoic?
Put the. I don't know.
Okay.
I don't know why. See, look.
That's
So
amazing.
no. What I'm saying is, if you read
Yeah.
my the PowerPoint previous
Right.
one, popliteal artery coming down, and in between tibia and fibula there's a hole, and
Okay.
they pass through that area
Perineal
to
tunnel.
come to frontal. Yeah,
Got it.
yeah. So very proximal you cannot really see. Looks like you're right. I don't know what that is. We can do anatomy. We can go to the lab and find out. That, to me, that's facial line. You can put the color flow if that what that is. That I'm transverse is not even longitudinally I'm doing it. See, if very small artery can be, that's not the
Alright.
the branch can go there, but that's not main artery. See, this is look at this. There's very small vessels there, right? Vessels
Yeah.
everywhere, but that's not the anterior tibial artery at all. See, look,
Okay.
very small.
Those are just vessels.
Right,
going in the
I
vessel
didn't look
space.
right longitudinally. But if I move,
Okay.
so I see what you mean. Why that is over there, right?
Yeah,
But
that's definitely
the small,
vasculature.
small blood vessel is going through that area, but it's not a main stem of the artery.
Interesting, because we do some injections from that plane. So we're just like going, right? When we take an anterior approach.
Yeah, I see what you mean.
So we're
because,
just
yeah,
going straight to
always,
vasculature?
to me, I think what Jeremy is asking is we always do injection through that artery to go to the posterior.
Yeah, in the
Okay, so
anterior
you
plane we do
interverse
injections.
membrane,
We're
when you say
obviously
that.
avoiding the
That major
anterior
main artery.
but we're going right through what that
That's
vessel
true.
would be.
That's true. So always, but we don't have that much because that's very small
Right, okay.
vessels. But if you hit the anterior tibial arteries, we're gonna have a compartment syndrome. But that happens many times, I
Okay.
think, but we don't know. But
Got
look
it,
at
thank
this. You look at this. Every line the teeny tiny vessels are
Sure.
over there. See
Okay.
over there. It's not whole one line actually.
Yeah, there's the artery.
Yeah,
That's
little
that's-
one is. See, it's moving from here.
Yeah.
Look.
It's supplying
It's
everything.
supplying everywhere. So I hope that you guys understand what Jeremy and I tried to make. Point is that artery coming from that a little distally, but it supplies proximally, right? And then okay, so now after this, where we are now? So the artery came up. We studied the peroneal muscle. We're superficial peroneal nerve over there, here. You see that one? Next to it. Yeah, that one. If you follow that one, later, if I remember correctly, this superficial peroneal nerve
And
now becomes superficial, which is sensory, in between the the EDL and peroneal muscles. Did you see it? It's
Yeah.
going up to the subcutaneously. So from here, pay attention to
Arrow up a little more.
Yeah.
A little lower.
Lower.
Lower. To the right.
No,
Oh, that's-
yeah,
yeah.
that one.
Okay.
So now I'm moving my probe distally. See, it going up. Now here, right? So that's gonna go to be sensory over there in between extensor, digital longus, and peroneal muscles, which is the head.
Okay.
But if you read my lecture, if I listen to my lecture, I explained to that one, and then it's going into the subcutaneously. Okay. So we know deep peroneal nerve, superficial peroneal nerve, sural nerve, plantar nerve, and plantar nerve we have to study because we stopped at ankle part, right? You didn't have a chance to read mine. Did you listen?
Oh, that's fine.
No.
I will.
No, what I'm saying is that because I tried to put more video clips, but we don't have that one. It's very hard. I don't know. We're gonna find out. This
We'll
all
have
the
to-
plantar
we'll
nerve.
have to do.
Yeah. But anyway, so from here, now we're gonna do medial approach. So next week we're gonna do more. After Jeremy and my Debbie study their foot, and then we can show better one next week. So I'm gonna put the left side of the screen is a proximal part of the leg. So here, medial side of the leg, let's study again. This is the tibia, I don't know you can see it, tibia here. And then, I forgot the popliteus, those muscles. But left side of the screen is gonna be tibia home base, right? And then this is the soleus, very first muscle. Oh, I'm sorry, what am I saying? The very top is gastro, but first muscle next to tibia is going to be the soleus. But actually I'm wrong. That must be plantaris popliteus. I forgot.
Well, how high up?
Yeah, so there are two muscles. Do you see?
Yeah. One.
And that's gastrocs.
Yeah.
So
Oh,
this
here.
is gastrocs.
Right.
This is soleus, but this is different muscle.
I know one.
See? There's a facial line. There's different muscle.
Go a little more
That's
distal.
the
If it
see?
disappears, it's going to be
there's
the
the popliteus.
Yeah.
Popliteus.
If you go more distally and it
But
disappears, that's the
Then we have to
popliteus.
go to here to talk about the plantaris, right?
Right.
So from the medial side, that's what I confused.
Okay.
Now I think we are right. This is the
You're.
popliteus.
Yeah.
Popliteus.
It should go around.
Run
So
like
if you
this.
follow their
yeah.
flow, if you.
Let's follow that one
Yeah.
because we studied this
Yeah,
last time.
because it should become bigger as you go more posterior and
So
then
bigger.
stop.
Can you change the height? The depth, not the height. See here, still we see it's getting bigger. Whole muscle, the whole round one
Right.
is the popliteus. Am I confusing with the popliteus plantaris? I always
Plantaris should be
Plantaris
coming
is
down
a-
this way.
top one.
It's one of the triceps area. Yeah.
And the plantaris is top one, popliteus is deeper one, lower one. That's what I'm trying to say. Correct? Am I
The
correct?
popliteus is a short muscle in the
Yeah.
popliteal fossa. Plantaris has a long.
Long
So
one,
that,
yeah.
like it shouldn't
But I
go
always
beyond
confuse.
here. Whereas if it's
It's not
plantaris, it
Do you want
continues.
it? I have a central anatomy if you want.
No, so here, if we look at it, show me one time. So here we'll go back. So here, when we look, put the when we put our probe very proximally, you see actually first muscle which we see is popliteus. Okay. Can you show the people what's the popliteus? That's the one. Okay. And next to is the top is the gastrocs. Now actually you see soleus here, soleus. But if we move close to the tibia, the soleus part divided by two. One is popliteus, one is soleus. Now you got it? Guys, can you see it as I toggle the probe?
That's popliteus.
That's the popliteus, but if I do that, soleus popping out.
Yeah, interesting.
Right, so I never pay attention to that one until we practiced the last time. So, because we said, what is that, right? Yeah, I
Yeah,
really
right.
remember, but only memorizing stuff.
No, I know.
Does it attach anteriorly to the tibia?
Tibialis.
Because right now, yeah, it's literally attaching to the tibia. But coming
Now
from
it's
the-
attaching to the tibia.
Is this the posterior knee though?
But now only solely soleus is gone, right? Soleus looks like a sausage.
No, I don't think that's it. 'Cause it attaches to the lateral.
Can you show me?
It attaches to the lateral knee. Right, we're on the right leg.
Right side the leg.
Yeah,
So it doesn't.
but no,
It doesn't attach to the tibia.
it does, but on the lateral side.
The other side it doesn't attach.
Right
Only-
here, look. Lay normal. Yeah. See, it's attaching over here and comes around more.
Yeah, posteriorly. So it shouldn't be attached to the lateral side, right? That's what you're trying
I
to
mean,
do.
the most it should be is like the
Pe-
posterior
the
tibia. It shouldn't be it shouldn't be attaching to the anterior tibia.
So we were wrong.
I mean, we could follow it all the way around, like you mentioned.
Can you just see the insertion and origin?
Yeah.
That's the
You don't
easy.
need that.
I
And
don't
then
know.
double check with the popliteus and the plantaris.
Oh, insertion posterior surface of the tibia above the soleus.
Yeah, that was it.
But it originates in the lateral condyle of the femur.
So if that was coming from like this.
Oops,
So-
it's
Oh,
sticky.
we gotta
So
find
if
it.
so from the lateral
Lateral
condyle,
condyle, yeah.
and then coming like this.
Yeah.
And then insertion to the tibia.
Posterior surface of the tibia above the soleus.
I think it's still.
That was it.
So we just have to follow it. If we
Okay,
can
let's
follow
do
it
that.
back
Why
up.
don't we do that since we
I think it was.
and
There's nothing else there.
right, because plantaris is gonna be proximal, so
Thanks.
proximal is different, superficial more, isn't it? So let's say left side is going to be more tibia side, okay? So now I have it here. This is the knee joint. So you said
Lateral femoral condyle is where it starts.
lateral femoral condyle. This is the one? This must be hamstring.
It's
That's
very
the hamstring.
yeah, but it's very deep.
Okay, so make it deeper, and then we.
The lateral
So there
femoral
are three
condyle.
muscles. There are three muscles. Can you guys see it?
Yes.
One, that's the longus. The long head, short head, right?
Yeah.
Short head is the downstairs one,
Yeah.
and then
Long
I'm gonna
head's a little
come
more
down.
Okay.
Where is the?
It might be coming in right now.
Oh, that one. That one
Yeah.
just popped out, right? That one must be popliteus. Then we're gonna follow the muscle. And below the knee. Popliteus is not this one. Lowest one, yeah, the lowest muscle, the dark one. And if I follow the one continuously,
That's the soleus. now,
soleus
right?
already.
Should be under the soleus.
This one,
Yeah.
that one, right? That's popliteus.
That's going in a different orientation.
But that
now.
goes to the different. Then you think that's the
Anterior.
flexor distal longus popping out?
It could be. It's tibial. It should. Yeah, I mean, that's the only thing that makes sense, that proximal and tibial. Because you're distal to the knee joint.
Last time we should go back to previous practice because we cleared the popliteus at that time. So now I'm gonna be smart, guys. I'm gonna say variant.
I don't know. I mean, I had arthroscopic
Okay.
surgery.
You know, I'm gonna left very politely. Because when I watched the video, I left too loudly. Okay. Here, I agreed to make it deeper. So here, which is the very proximal of the knee joint. Still, we are below the knee joint, right? As I come down, there's absolutely two muscles. Before soleus, that's the soleus.
This is soleus.
And then the top next to tibia, what is that? And the gastric is coming here. There are three muscles. Actually, now can you freeze?
Yeah.
I see clearly. So if we cursor,
It's perfect.
yeah, this is the tibia, right? This is the tibia. This is the fibular. This is soleus. This is gastro. This is a triangle.
That should be
I think it looks
FDL.
like an artery, this
Okay.
one. But this is going to be FDL. But this is very proximal. I don't know. This can be posterior tib. The posterior tib is always between the fibula and tibia. Posterior tib should be coming out now here. This must be all flexor distal longus. I'm going to
Do you want me to
move my
move my
probe
toes?
longitudinally and then we can see better, right? But this is very interesting picture because we were here, right? We were very about 1/8.
Want me to flex my toes and see if it
Yeah,
all works?
we're gonna practice today different things than usual. Okay, so now I'm here very proximal. Guys, can you see? Very proximal. Just below the knee joint, we see that whole soleus and different muscles. Now what I'm gonna do, if I move, now the left side on the top of the tibia is disappearing and it's gone. Right? Pure soleus only. At this point, we are about 1/4 came down from the knee. So now, when I am here, this is our question, right? We don't know. So
This one, you don't know.
yeah, longitudinally. Oh, we're gonna follow that one.
Is it right over my scar?
No, a little bit less. Here, if you look at it, gastro soleus, but I cannot get to that point. Here, look, gastro soleus, flex. Can you wiggle your toes? That's gastro. Here, don't move this. Only grab my fingers. Are we doing too much? Not really. We have to know these things, right?
Yeah.
So this is I see continuously 3 different muscles, but I cannot. Here, look, I'm like oblique view, right? There are little teeny tiny different muscles. I don't know what that is. That's popliteus. What can it be?
Dr. Zizi is saying that
What's that?
popliteus and plantaris.
Plantaris? Do you think that is plantaris? I don't
Plantaris is
think.
more posterior.
Yeah. Plantaris, we have to go all the way here.
Plantaris should be. That's plantaris. And then
Plantaris is not going close to the tibia at all
lateral.
because already it's tendon.
Lateral compound.
But look at this, the popliteus is very
Superficial. Or deep.
the deeper to the tibia. It's attached to tibia,
Mm-hmm.
so it has to be tibia. The plantaris,
Popliteus.
popliteus. Again, can't.
Maybe my popliteus is just a little longer
No,
than.
no, no. We had this last time. What was the model? See, as we scan down, it disappears. So, what time is it?
7:47.
Maybe some of it has only muscle.
The only other thing I can think of, I wonder if my graft is making things obscured. Because it would have to be that my popliteus is longer.
So
than
here
usual.
is very clearly, I can see this is the soleus and flexor distal longus because I already mid-third, right?
So Dr.
Yeah.
Zizi said plantaris is very superficial and proximal.
Right,
So this is popliteus, the one
no,
that's
no, no,
here.
but when you think about the origin insertion,
Yeah.
the plantaris insertion is where? Origin and insertion.
Well, because the tendon very quickly it goes all the way down to the
Yeah, so
Achilles,
it's
right?
not, it cannot be plantaris.
I think my popliteus might just be longer than.
But we had the same,
Right.
I see quite often this one.
Yeah.
When I do the injection to the patient.
We
I get
haven't
to
seen
see-
plantaris yet on here.
To me, that's plantaris, the popliteus.
Yeah.
Okay, Dr. Ajiji, we apologize, but our conclusion is popliteus, and then here. So look at this. It's kind of 1/7. We came down. It's almost now it's gone. Popliteus is gone. So the first one is soleus, right? Soleus, and then as I move my probe to posteriorly, the gastro coming out. The gastro, soleus. I'm moving my probe to tibia anteriorly, and then if I twist, so if you look at this, this is very deep, right? So where is the flexor distal longus?
Flexor digitorum longus should be tibial, so it should be this.
No, the artery, the triangle one.
This is the triangle, right?
Yeah, that is the. So I'm gonna longitudinally move. That's gonna be a whole flexor. Look. This is the way you can tell which is the flexor digitorum longus. All of them.
All of this.
All of triangle, yeah.
Okay.
And then underneath, between the tibia and fibula, that one,
Right here.
right, that one is a posterior tip.
Okay.
So if you push my plantar flexion inversion, relax. Plantar flexion inversion, but the move toes. Right? So the whole muscles are moving. So I'm gonna twist to show longitudinal view. So I'm gonna move. Left side is gonna be more close to the tibia. If I move like this, where's soleus? I didn't move. There's soleus. And then this is the flexor digitorum, right?
All of this.
Yeah. So that's whole. That's now I'm moving this way. So now clearly we know which one is the
This whole triangle.
all triangle. That is the flexor digitorum longus. So we're clear now, right?
Yeah.
So if you guys not so sure, you twist your probe longitudinally, right?
Mm-hmm.
Then you got to
We have 3 layers.
double check, right? Here, so move like this. But we learned last time that motor point is in between 2/3, middle 1/3, right? So where I put the probe, which is kind of motor point area, you see 2 vessels over there. I'm gonna go posteriorly. The 2 must, I think must be anterior, posterior tibial artery and the fibular artery. Look at these 2 artery. Pay attention. If I go proximally, they're gonna merge to become popliteal artery.
No.
Yeah, here. No. See, now it's become
Mhm.
one,
Yep.
right? And then if I move distally, split in
Mhm.
2. See,
Mhm.
very clear. So we all know now very clearly. So look at these beautiful muscles. So top is the soleus. In between this artery area is the flexor digitorum longus. Underneath is gonna be posterior tibialis because it's between the fibula and tibia. And if I move to posterior, it's become more clearer,
Yeah,
right?
that's
The bastard muscle is coming out.
Yeah.
So now you guys can tell. Let's say many times we get very confused when we look at the patient's leg because some patients' leg is very hyperechoic, hypoechoic. So if you're not so sure, longitudinally, vertically, you move your transverse, and then you have to know the environment, the structures like vessels and nerves, because in the next to tibial artery, always there's a big tibial nerve is moving together. But here you cannot see well. Look at this. How you see it? But children is very hard, easy to see actually. The next to artery between the fib. When I look at it, the fibular artery doesn't move with the nerve. Right. Tibial artery moves with the tibial nerve.
Mm-hmm.
So even you can differentiate which artery, which nerve. So I don't know. You can try one time before we finish. But
Oh, the last thing, FHL.
flexor hallucis longus.
Yeah.
That's we have to put her in the prone
Oh, you
position.
gotta be.
It's much easy.
We don't have to do it. We could practice first.
Yeah,
We've
practice.
already done.
But interesting that we repeating the same place is very nice, right? We can teach it. We can learn
Yeah.
gross anatomy. Then we go more detail. Or our question comes.
Oh no. We're
Do you have it? Okay. So let's start. You're gonna explain whatever you learned.
I got 6 minutes.
Okay, only 6 minutes.
Do you want to start anterior or do you want to start?
We can
Like-
start
6
it.
minutes, you can explain everything. We didn't study that much.
There we go. We're right on the tibia now. All right. As I come a little more laterally, left side of the screen is more lateral. Right side of the screen is more medial. So the most lateral portion of this we see tibialis. Hmm?
The lateral is
Yeah.
the lateral aspect.
No. Wait, hold on. Yeah. I confused myself. So
That's
TA
okay.
is right here,
This is
right
TA.
right off the tibia. It's very small up here, and then as I come more distally, now it's full in view. So that's the tibialis anterior. As I come slightly more laterally, then we have the
EDL.
EDL.
So
And
you
then
guys
more laterally,
remember he flipped over his probe. Okay, that's okay. That's the
Yeah,
exercise.
that's what,
Hernias longus.
It's beautiful. Yeah.
and then below everything is going to be the TA, below the interosseous membrane with the artery in the bottom left corner. And then if we reverse it as we were looking at earlier, or I guess the normal way, then on the left side of the screen all the way is the tibia, then the TA, then the EDL, then the peroneus, and then below that is the tib posterior with the artery in the bottom right corner of the screen. And this is how we were looking at it
And the
earlier.
nerve.
And the nerve.
And a superficial hernial nerve.
When you are not so sure, you can scan up and
Yeah.
down a little fast, and then you can see the nerve.
I'm not lateral enough for the nerve.
Yeah, now we see. We are too low
Oh,
to
I
see
see.
that. It's already moved superficially, I think. I see over there. Over here. You're going down, right? So
Yeah.
it's already in the superficial with the
There it's
subcutaneous,
coming up.
Yeah.
No. Yeah, so now it's superficial right
Superficial,
up.
yeah.
And this is about halfway down the leg.
Uh-huh.
And then if I go more proximally,
It's
then the
coming
nerve
down.
is.
Here, over there, and where the arrow is. Yep. Over there.
Yeah,
See,
there,
it's
okay,
beautiful.
there, yeah.
Yep.
On the arrow is.
Now it's almost going to
Superficial.
subcutaneous.
But now, right in the middle of the screen.
Yep.
There's the superficial fibular nerve.
That's amazing.
Right. And then if I go to the lateral portion of the leg,
Whoops, that's all right. I'll find it. Okay.
Just a phone.
Do you need some more?
Yeah, sure. Right on the fibular head. Come a little more posteriorly. Now we're in the posterior compartment. I come more laterally. Now we're in the lateral compartment. So there's my fibular head. So now I'm going right under it. And we have the fibularis longus and brevis on. So brevis is further down. So this is brevis. So as I come more proximally, we have longus on top with brevis getting smaller. Okay, so right here we're at fibular head, and then as I slip off the fibular head, to the left side of the screen is mostly longus, which Debbie's highlighting next to the arrow, and then there's a right on the bone, it's a small brevis. So as we are more proximally, longus is way bigger than brevis, and now again I'm right off the fibular head, so I slip down and I'm going to come more distally. So longus is a little bit to the left of the screen with brevis, again, right over the bone, and I come more distally, and brevis is coming more into view, and now they're about equal size, with the top half of the sandwich being longus, the bottom half of the sandwich being brevis, and then as I come more distally, longus is getting thinner and thinner, and brevis is getting thicker and thicker. I'm about halfway down the leg now. And now we're almost fully brevis on the screen. So I'm coming lower, I'm running out of gel. Okay. And now I'm coming more distally. So now I'm getting near the lateral malleolus.
Now I see everything from far. I see.
Yeah.
Fun.
So where longus is at the very top of the screen.
So cute.
And then brevis is a little bigger over there, where the arrow is. Longus is in that top left corner right off the fibula. And now we're getting to the view that we had earlier. So now we have longus in the top left of the screen, in the tendon sheath. We have the brevis, which is being highlighted with the arrow. In the top, we have the sural vein, and then sural nerve.
Sural vein, small
Small
saphenous vein.
saphenous vein. And the sural
So
nerve.
use this one. Let's see.
And then all the way at the right is going to be the Achilles muscles.
Use this.
And maybe
Okay.
some fat.
So we're gonna
Okay.
change it to hockey stick to show the sural nerve better, and then you can show hammock sign. We studied last time, right? So let me help him a little bit. Elevation technique.
I was trying to lift it. You said elevation. Oh, I see.
Oh, not the
Yeah.
The gel, yeah, the gel.
Gel.
Alright,
Oh,
so
see,
at the,
much clearer.
yeah.
Look at that. Oh
so
my.
at the right in the middle of the screen right now we have our fibula. Alright, so as we
Lateral
come
malleolus.
put the fibula at the very top left of the screen.
So you can stop
And-
over there. Stop.
Freeze it?
Yep. So you should tell us where's the penis longus.
Longus is
That one,
that's
right?
longus.
Very
The
clear.
brevis is bigger.
Okay, unfreeze. And then he's gonna go more posteriorly to show us.
As a more posterior.
Yep.
I'm getting more towards
Achilles tendon.
yeah. So actually as we learned earlier, so longus, brevis, then small saphenous vein, then the sural nerve right under it, where I guess at the 4 or 5 o'clock position, right?
So here,
that the sural nerve?
very hard
Or
for
the-
me
the 3
to
o'clock?
see. So you add more gel. So you toggle. So that part, the next to the round one, that's the sura nerve. But you can put the color flow in the dark one.
And this is as we're halfway to the Achilles, but
Yep.
we're stopping.
Relax a little bit. Can you just get rid of color flow? Yeah. Has to be here. Yeah. Surrender with that one. Can you
Yeah.
remove the CF, the color flow?
This is the sural nerve, right? There was no color flow on that.
The sura nerve is very interesting because it's so easy to see your sura nerve. I'm blaming Debbie. If you will look at the hammock sign from here, you can see honeycomb. Okay, stop there.
Right in the middle of the screen.
Yeah, that's the honeycomb
Like
shape.
the direct middle.
Now that is the sura nerve.
Okay.
Left to that one, that's the summa saphenous vein.
Okay.
So I think just knowing this structure, you can see two structures in between peroneus brevis and Achilles tendon, and then the honeycomb shape comes.
Okay.
So many times actually, if you guys review my slides from last night, that it's very clear. Some patients are very clear. Some patients you have to just think about the environment, how the relation between these two structures. So okay, unfreeze, and you can complete
And then
your
bring it home. We had the vein, the nerve, and then sorry.
Now,
On
oh,
brevis,
now it's better. Yeah.
brain, vein, and nerve right in the middle, as we just described. Yep. And then as we come more posteriorly, then we're getting to the
Achilles
Achilles tendon. I don't see any bumps, but right there, a beautiful Achilles tendon. And
I
didn't
feel
get
like
to do the
Achilles
detail
tendon
there,
is more hyper-equipped than what we see now, but your Achilles tendon. Did you drink a lot last night?
No, I
Yeah. Look at the Achilles
Alright,
tendon.
and
Push my hands
longitudinal.
down. Push my. Oh,
Oh,
slowly,
yeah.
slowly, slowly. Push a little bit, and relax. We don't see any tendon tear over there.
no tendon tear. Yeah.
No tendon tear. Oh,
And
look
then
at that. It's beautiful.
Distal, that is the TP, right? That's all posterior tibialis.
Hey, come on. Whoa, my favorite is coming. How are you? See you in 2 seconds.
Alright.
Set.
Oh.
Set.
This one.
Where is it?
This one.
Oh, I didn't say. Yeah. I didn't say hold.
Yeah.
Okay, go.
Well, this is the Achilles and longitudinal view, and I think that's good for
That's it.
now, right?
That's it.
Alright, that's it.
So today we had fun, but thank you so much, everybody. If you have questions, you go back to book and study hard.